this session, I will only introduce the basics and will give some introduction about some of the uses in healthcare. So the objective or the learning objective will be to introduce the concepts, tools, and processes of system thinking and dynamic modeling, and to demonstrate the benefits of system thinking and dynamic modeling approach in addressing the complexity of related to the healthcare industry. And the last thing is to present, I will present just overview of some case studies that use system thinking in healthcare. The session will split into two parts, part 1 and part 2, so we can have a Q&As between the two parts instead of having it all. The first part is focusing only on the what and why. What is the system thinking and the application of it, the thinking about our thinking, and the healthcare system complexity, and the system thinking introduction. In the first part, in the second part, I will talk about how we apply the system thinking in healthcare. So we'll discuss some of the tools, and we'll have an overview about how we do the dynamic modeling and the uses of the modeling in healthcare. And we'll present just case studies, 4 case studies, so people can rely and see the relevance of it in healthcare. So for part 1, I would like to start with the name, systems, system thinking. So to identify these 2 words, in the chat box, maybe people can just, what types of systems do you know or do you come across? If you can help me by sending some in the chat box, and Dr. Tabrika can help me share that with the audience, because I cannot see the chat box from here. Anyone can throw one type of systems that he knows.
Yes, Doctor, one of the answer is complex system.
Complex system?
Yeah.
Mm-hmm. Then we start from the end with the complex systems.
Only this answer.
Okay, so they are in any, you can classify systems in 4 main categories. It's the simple system, complicated system, and chaotic systems, and complex adaptive systems. And for each one of these systems, you need a different type of thinking about it. So this is why I would like to discuss thinking about our thinking. So I will go through each one of them very quickly. The simple systems is you have few elements in that system, few factors, variables, or agents, and there is always a stable relationship between the variables. You have very limited types in between limited types, causal relationship, limited confounding, and the effect of modification is limited in these systems. And usually the relationship is very deterministic statistically. You can see the pattern very, very, very obviously. So this is the main characteristics of the simple system. The complicated system, you have many elements in the complicated system, but still it is the relationship between them may be unknown for you, the audience, or unstable relationship. And the most important thing is that there is no adaptation. There is no flexibility in the system. And it's not about the complexity, it's about the flexibility and adaptation for change. So there is also very poor fit for statistical predictions, not like the simple system. And you can see this is, maybe someone will say, okay, this is very complex. No, this is very complicated. It's not yet complex. The one other example is, for example, the parts of the car or the parts of the airplane or how you do that. All these are just complicated systems. The chaotic systems, there are many elements. There is dynamic came into play here. The dynamic relationships, there is critical role of initiation of the condition and no adaptation in these systems. And apparently there is random ordering. For example, one of the chaotic systems will push you to act even before you think. Like if you are in a place and you have this fire alarm going on, the first thing you will not be thinking about what is happening. You just run, rush, go to the assembly point, take yourself away from the hazards. And then after that, you can start thinking about what's happening, what is going on. The third one, the fourth one is the complex adaptive systems. And this is the main area of implementation or using of system thinking. In the complex adaptive systems, there are many elements. You have changing and unstable
دكتور عبد الرحيم السلام عليكم دكتور.
عليكم السلام.
معذر المقاطعة، معلش ممكن تسجل المحاضرة بس عفوا، الريكورد الظاهر عندك.
Recording I think دكتورة تبارك
هي عندها بروبلم كده، شوف يمكن من عندك انت، اذا لان لو قدرت تعمل ريكورد بيكون ممتاز، لان المحاضره بتكون ممتعه جدا بالتاكيد.
يا جماعه it's being recorded. الريكوردينج فوق في السكرين باين ان it's being recorded.
It's running. Okay.
اوكي شكرا
شكرا جزيلا. The complex the relationships between the parts are not are changing, and it is predictable somehow, but not in all details. And the most important thing is the emergent behaviors, like adaptation, learning, self-organization. So the dynamic of the system is there. You push it in some place and will be adapting itself to a new thing. And the other part is non-linearity, as what is called scale-free. The relationships are not linear, and it's usually in the natural relationships, it's circular relationships. So it has two characteristics in the same time. It has divergence, which is the unintended consequences of different outcomes from the same input. You have same input, and then different outcomes will come out of this similar input. But at the same time, it has this convergence characteristics, which mean you will have many routes leading to the same outcome. So you will have this convergence characteristic. The third one, the last thing maybe we can talk about is the characteristics that most of the biological, social, economic, and physical system have interacting agents can be, and changing environment are complex adaptive systems. Like this, the environment is very complex, but at the same time, very adaptive. And in the organizations, you have these characteristics. The organization systems in any organization, because it involves human in it. So that human engagement in the organization, if you exclude the structures and these things, this will be just a complicated system. But when you get in the human in that in your thinking, you can think about any organization as a complex adaptive system. The second issue is the thinking. So the types of thinking, maybe there are many types, many classifications, and people are talking about it, but we can share these 7 ways of thinking. The first one is maybe it's one of the classifications, is creative thinking. which is the ability of conceiving new ideas, the analytical thinking. The analytical thinking, which is most of us use in healthcare, is separating the whole into basic parts and then examine each part alone and see the relationship between them. The critical thinking is a process of examining and carefully evaluating and creating judgment. So the critical thinker will try to determine the authenticity, the accuracy, the validity, or the value of something based on their judgment personally. The concrete thinking is usually on the application of knowledge, and you think about it and you comprehend that knowledge and apply the factual knowledge on practical things. The abstract thinking is ability to relate seemingly random things. It's like creating connections, which usually maybe not all people can see. So the person who have very strong abstract thinking, you exploring different solutions and from then select one of these solutions. While the convergent thinking is having different parts, different solutions, and joining them together to come up with one better solution. I just share that in the beginning because you need to use these different models, different thinking types to solve an issue. The second part is the healthcare component, because we would like to apply that in healthcare. For now, I think the challenges of the healthcare interventions most probably is we have very advanced medical practices, but still the health systems all over the world encounter complex challenges of meeting that primary goal. The primary goal of healthcare is reducing the burden of disease and injury. Although we have good practices, very advanced technology, but still the world is facing this burden of disease increasing, the disease and injury is increasing, because most of these problems are complex and showing resistance to decades of attempts to solve them. And many of healthcare interventions fall short of achieving the goals because of this design in the piecemeal design, focusing on a narrow area and trying to get results by touching the system in only one part of it, rather than having comprehensive and whole system perspective. So because generally people use conventional analytical methods, and conventional analytical methods by its nature is static, and it is incapable of addressing the dynamic situation of the population and the need changing over time, the risk factors, interactions with disease, and the issue of the resources needed to address these issues, and the instability of all that context, and the usual thing of the fragmentation. Anyone working in public health can see that fragmentation and piecemeal design of interventions. For this reason, I think the health system are failing to address the main things. And that is deeply rooted in our training. When we go to medical schools, to make this the syllabus, okay, people will dissect and okay, creating different specialties, different systems to study the human body, to study the diseases. But by the end of the day, they forget to put them again all together. So people go from the specialty in ophthalmology now going to only specialize in retina, only specialize in this. The over specialization in the medical practice also affecting our way of thinking, about human body, about the nature of the diseases itself. And at the same time, in the health system by its nature is complex system. And usually the complexity of the health system, because it has diversity and also connectedness and also interdependence. And you can see it sometimes learn and adapt itself. We have different types of actors in the health system. Also, all people are close together to do the same thing or the similar things, and how actors respond to each other and the adaptation. And if a program is introduced or intervention is in this complex system, you will have some outcomes intended, but usually you will have unintended consequences of these interventions, like the distorted services or the synergies of the effects or the unsustainability of the interventions. And we can see that in these vertical programs where resources is pooled to address, for example, only malaria or only polio or only TB. And then by the time the health workers will be focusing on only these diseases because it has more incentives to go for it. So the complexity of the system by its nature make the interventions need to be focused. But at the same time, that will come up with unintended consequences, and sometimes it contradicts the interventions. So as a message at the end of this, it's if you wish to understand the system and so be in the position to predict the behavior of the system, it is necessary to study the system as a whole. Cutting it into small pieces will not make it small systems in each one of these pieces. This is just a representation of that. If you just cut the animal into cutting the cow into two, will not make it two cows. Also, cutting the system into small part and trying to intervene in each part alone will not make it. Will not help you achieve that thing. The health system definition is not just that system which is related to health. It's not just the care of health. Also, population health and public health is part of the health system. So the traditional definition is that the health system is combination of resources, organization, financing, and management that culminate to deliver the health service to the population. And also, WHO have another definition that is all activities whose primary purpose is to promote and restore or maintain health. So by this definition, we have a very broad system related when we think about health systems. So this is the first part about the systems, the thinking, and the health system. Now we will speak about system thinking, the introduction of it. The system is defined as organized. Each word of these words has a meaning, and if it's missing, what we are talking about is not a system. Organized, interconnected, interrelated, integrated elements forming the whole. And the main thing here in the system is that its parts are connected. Changing one part or connection affects the other elements of the system. And also these parts are operate towards a purpose. There is a common goal. There is a purpose for the system. All its parts is working together to achieve these goals. The non-system parts are independent. In that one is connected. Here, the parts are independent. Changing one part does not necessarily affect other elements. And usually there is no explicit purpose for these parts to be together. It's just happen to be together. A group of pens in a cup is not a system, it's just a group of pens in a cup. And you can use these measures to identify, am I talking about a system or just part altogether? I think this will show specifically what we talk about. What it is, this different part of an enterprise. For example, you have HR, you have admin, you have manufacturing. You can change this with any names of departments that in the organization, marketing and sales, customer services, and these are operating under the overall environment of industry, market, regulations, technology, and things external to it, and they are interconnected and related to each other, and they are operate to each other to achieve this enterprise mission. If I touch one of these, for example, you change something in the admin and management, it will affect the customer by the end of the day. If you change services, it will need something in the manufacturing and production, and so on. This is just to make it simple how the systems are operating together. The system thinking as a field, it has been founded by the late Professor Jeff Foster in MIT in the 1956, and he defined it as system thinking allow people to make their understanding of social systems explicit and improve them in the same way that people use engineering principles to improve their understanding of mechanical systems. Because Jeff Foster is he's an engineer, and he is the founder of MIT Business School, and that business school is designed in a different way. This is why MIT is unique in their curriculums, because they use principles from the engineering, mechanical engineering, and they apply it to the organizations. And based on that, they develop this field of system thinking. Unfortunately, I feel lucky to study under the student of Jeff Foster's, with my CEO here in this company. He studied directly from him the system thinking. I'm working with him for the last 4 years, and I feel very lucky to have this opportunity to work on this field under his leadership. So system thinking, the principles are that you need to look at the big picture instead of focusing only in the narrow area. We also need to focus on long-term versus short-term goals or outcomes. In the system thinking, you need to think about dynamics, the complexity, and the interdependence of the factors. And also, we will include in your thinking the measurable and non-measurable or soft indicators in the system. And we are all part of system, and usually there will be an unintended consequences of the interventions. There are assumptions from you, from the customers, from your management, and also you have to take into account the values and beliefs of people when you are designing that thinking. So the system thinking is usually used to examine how we create our own problems. Any challenge we have, usually it is a result of previous thinking or interventions or something. It is used to see the big picture, because when you start rolling out your why questions, this leads to this, this leads to this, this leads to this, and you are trying to connect the dots and create relationships. And the most important thing here is through system thinking, you can come up with a structure that influence the performance, or the structure that influence the outcomes that you are looking for. And this will be the focus of your interventions, is to look at the structure, not only the events at the high level. You go down, you go deep, and analyze the issue to reach the structure that influence the performance. And this saying is reflecting exactly why we are struggling, and because we cannot solve problems by using the same kind of thinking we used when we created them. The problems that we are facing has been created by us. It has been created by our previous way our thinking and our interventions that we have. So the examples of using system thinking is and shows the value is in complex problems that involve helping many actors see the big picture and not just their part of it. Because when you use in the process, you should work with different actors. You should work with people. You should work with, you identify the stakeholders and you work with them to come up with the conceptual models before you go to the mathematical models. And when you are doing this with people, you will help them see the big picture. And sometimes only doing the conceptual model will be very helpful in addressing the issue. And also it's very important, it shows value in using it in recurring problems, or that has been made worse by passing attempts to fix them. And one of the archetypes of the system thinking is that fixes that failed, which is, it means that you have a problem, you rush to do an intervention, and then the intervention make it worse, make it create another problem, and then you will run to solve that problem by implementing an intervention, and that intervention will also create another problem, so on. Issues where an action affected by the environment surrounding the issue, either the nature of the environment or the competitive environment. Yeah, and this is especially in the market, business market, you can see that it's not only because you are not the only actor in that field. Other people will act, and they will create an environment that affect your performance in the competition in the market. Also, it's very, very, very good in problems where solutions are not obvious. If there is a problem that is very obvious how you will solve it, system thinking is not for it. So it's not for complex systems. Sorry, it's not for simple systems. It is not for complicated systems, because still it is simple, but it's for complex adaptive systems. Here, just a comparison about the way that we think and the system thinking. The traditional analysis focus on the separation of the individual pieces of what is being studied. In fact, analysis actually come from the root, meaning to break into constituent parts. So when we talk about analysis, you take the part from each other, then you break the connectivity of it. Then you would like to study each one of them alone. In the system thinking, the focus is on the things being studied is the interaction between the constituents of the system, the elements, and the behavior produced by these relationships. And in general, you can think about it, the overall view. Here we focus on part, here we'll focus on the whole. In the key process here, analysis. The key process in system thinking is synthesis, because you would like to see the relationships instead of and create that relationship and the direction of the relationship between the parts. The type of analysis here is deduction, and the type of analysis here is induction of new things. Focus of the investigation here, the attributes. The focus here is the interdependence of the objects. The state during the investigation, there is an assumption here, it is a static in the traditional thinking. And that will be very obvious when we do the modeling in the economic science. Usually they have that constant in the equation. They will say, this is a constant. And in real life, there's nothing constant. Everything is moving and in a dynamic situation. So in system thinking, you think about this dynamic situation and you can represent that. The basic assumption here is cause and effect. It's just this lead to this. But in reality, there is usually multiple and probabilistic causality. And usually there is a link. A will lead to B, B will lead to C. This is in the traditional thinking, but in the dynamic thinking or system thinking, you will think A will lead to B, B will lead to C, C will lead to A somehow. So you need to find that loop and to close that loop. The problem resolutions here, usually static solution here is usually for dynamic modeling. The operation of the parts here is optimal. In the system thinking, you think about it as optimal because usually it's changing. The theories of system thinking is coming from multiple origins. There's multiple disciplines and problems system thinking. There are many different theories and methods and tools used. So it is a meta theory, it's not a single theory. It is more an approach of dealing with the issues rather than like one size fits all. It is its approach, it's cross field of scientific, philosophical, and technological inquiries, and you can use it in different ways. And itself, it focuses on the self-regulation of the system, which occur when we do interventions. And here is a list of many theories behind the system. I will not go through the details of it. I mean, part of it is catastrophe theory, chaos theory, learning organization theory, path-dependent theories, punctuate equilibrium social theory, the agent-based modeling, mathematical modeling, network analysis methodology, system dynamics modeling, the causal loop diagrams, which is linking things together, innovation or change management history, participatory impact pathway analysis, also part of the how you deal with the stakeholders, process mapping is part of it, stock and flow issues. So in conclusion, it is analyzing our approach to issues rather than only having one way of dealing with it. This Iceberg is reflect how usually we react. One of the things we usually think about the events, what just happened, and we react to these events. If we can look at a little bit the second level, we can see the patterns or the trends, what been happening, and have we been here or someplace similar before, and we analyze that and we can anticipate if we have the pattern, our reaction will be different. We anticipate that this will be happening in the future. Then if we look deeper, we can see the structure, which force the factors to play and come up with these patterns and come up with these events. And in the structure level, we can work to design and redesign, and this is the organizational redesigning. And these structures are an outcome for mental models. And how does our thinking allow this situation to persist? And in this level, we talk about transformation. This is why system thinking can be used for transformation of organizations or people. Because usually in the first level of the events, we usually focus on the managing the crisis, task, and we have that sense of firefighting. This is happening, okay, well, let's address it. This is happening, let's address it. And in the trend level, we can see the pattern and we can anticipate. But deeper, we can see the structure. And the most important thing in the structure is how people think about the issue. And we can do the redesigning. From how we can, the influence, the leverage of influence, usually you go deep, you will have better influence. If you address the structure, then you will change the pattern, you can change the events, but you risk that this structure can come back again because the mental models which create that structure is there. So you need to address, once you go deeper you have better leverage and influence. So if you wish to influence or control the behavior of the system, you must act on the system as a whole. So tweaking only part of it and hope that this will change things is just doomed to failure. That is why connectedness is all about this change of thinking. So I will stop here for a while. We can take questions before we go to the next part. Yes, Hatim.
Assalamu alaikum, Dr. Abdelrahim. Thank you so much. This is very interesting. And when we look, for example, to what you mentioned, we remember definitely the different aspect of the certification. When you talk about the iceberg phenomena, we already remember the root cause analysis as a part of the quality tool. We have to look for the root of the causes. And when you mention already the mental model, we look for also the importance of vision, mission, and looking to the whole, not a hole in a patient, as we will talk, for example, in a peptic ulcer patient. So thank you so much. Just proceed. I'm not sure whether somebody would like to ask any question. Feel free. The topic we know is new. The topic is interesting, but definitely will be a foundation for further courses. Shukran, Dr. Abdelkarim. Somebody raising hand.
Yeah.
Welcome, please.
Assalamu alaikum. Thank you, Doctor, for this interesting presentation. My name is Reha. I'm working at the Ministry of Health. I just want to actually just a comment on the, sorry. I just want to comment on how generally the partners and the donors for health, or the partners for health, are now in generally taking, let's say, a system thinking way of addressing the issues, because as we see, two of the major donors for the vertical programs, HIV, TB, malaria through the global health, and immunization through the Gavi, they are now addressing other system issues besides they're addressing to the vertical or specific diseases. However, through the system thinking, I believe the countries are not really prepared to think this way in order to suggest interventions that are going to address the health, the whole system issues related in general to the system, not only related to the disease. And I also believe that still those international donors and partners, they still need to be affirmed on how they think of those vertical programs, especially to ensure that the conceptual understanding of the system thinking when they address the issues, because they keep coming back to trying to link those system issues with the specific program of their interest. So I think this is a very good approach and a start, and we need to orient the countries nationally, of course, and prepare them to this kind of thinking. And this way they are going to get the most benefit of this kind of new, it's not actually so new, but maybe the new in terms of how, what are the issues to be addressed through these interventions. Thank you.
Thank you so much, Dr. Reha.
Any questions so far, or we can proceed? Thank you so much, Dictora, and I think this is very interesting. We remember we worked previously in Sudan and different vertical program, although they have many resources like malaria, TB, polio, but still the outcome is not good. And this is why it came to the health system strengthening Gavi initiative. They came together to address this issue. Thank you so much. طيب اتفضل دكتور عبد الكريم دكتور عبد الرحيم.
Okay, طيب we'll go to the next part of it, which is the tools. because you have concept, you have tools, and you have processes in any area. The tools that I will discuss is the three three tools. Many of you will come across it, which is the causal loop diagrams, the behavior over time graphs, and the stock and flow diagrams. Because you will use this in the modeling. There's a specific language which is maybe you can orient ourselves with it, which is the causal is a link between two variables when we talk about causal loop diagrams. And this direction, the arrow is S. It means that the change is at the same this same direction, because the relationship between these two variables going in the same directions, or you can name it as plus. The O, or the negative, it means that the effect, the relationship between the two is in the opposite direction. If you have more from this, it will decrease the outcome. The other one, the same direction, if you have more of this, it will increase the outcome. Then the R and P, which is the reinforcing feedback loop and balancing feedback loop. And for a system to operate, usually you need at least one balancing loop, because if a system is just reinforcing itself, it will reach a level where the overshoot and collapse, because you cannot, system cannot sustain, come to that equilibrium level. So for example, this is the desired level, there's a gap, and usually this is delay, and this is how you can see it in these circles, where you can see these causal loop diagrams or conceptual models. The other part is the language of accumulators, which is the stock and flow. For example, here, this is flow in, this is accumulation, this is depletion. For example, births will increase the population, and deaths will increase the population. This is in a simple way, flow pipe and depletion pipe. The causal loop diagram is just a useful tool to represent the dynamic relationships between different variables. And also it provides visual representation with which you can communicate and increase understanding of the issue. And it's also, it make it very explicit to understand the system structure and capture the mental models of people, how people are thinking about the issue. And you can see this, for example, this is divergence behavior. This is reinforcing the same direction, and the behavior over time will be just increasing. This is overshoot and collapse. In this structure, it is a balancing loop, and you will have a divergence behavior over time. This is an example of feedback loop or causal loop diagram for immunization, for example. The demand of immunization is a central thing. The demand of immunization is affected by different factors. So here you can see the effectiveness of the health centers, the trust in the health system, the immunization awareness, the number of immunized people, and epidemiological prevalence. These factors can be collected in the beginning. When you interview the people, you will collect what factors influence the immunization demand. And then with this help of people, you can draw up these circles, like the demand of immunization is affected, will be, if the demand increased, it will increase the number of people immunized. If the number of people immunized increased, it will decrease the epidemiological prevalence of the cases, but there is a time delay here between the immunization and the prevalence decrease. Is if the epidemiological prevalence increase, this will increase the effects of the disease on people, and then this will increase the campaigning for immunization, and this will increase the demand immunization awareness, and the immunization awareness will increase the demand for immunization. And here you can see these are interventions, like effectiveness of mobilization will increase awareness, the health education activities will increase awareness. So you can follow each one of them, and in the causal loop diagram, it should be closed system. Only the interventions will come from outside. So it should be a circles closed, and you will name them, you will add the positive and negative based on the relationship between the two. So you are not only looking for the relationship, but also you should look to the direction. Is it positive or negative? And you can take this and make the stock and flow diagrams. The stock and flow diagrams is a mathematical representation for this relationship. And based on the first part, based on the conceptual model, you can build the structure of the system, and then you can do the you can see the system behavior in the model. I would like to go directly to the modeling and how it's done. The system dynamic is just an approach to understand the non-linear relationship and complexity of the system over time, using the stock and flow, the internal feedback loops, and the time delays. And we need to think about the time delays. We cannot see the outcomes immediately. So it is a methodology and mathematical modeling technique to frame, understand, and discuss complex issues and problems. Usually we use this, for modeling to reach this level, we use 3 steps. The first step is learning about the solution, which will start with idea generation, the different things that we are talking about. And based on the idea generation, this should be done with the subject matter expert. You gather information, and you, based on this idea generation, you can design the conceptual model. And in the conceptual model, you will verify it again with the stakeholders, and then you will collect the data that is to support the conceptual model. Based on the conceptual model, you can build the computer simulation model. And the computer simulation model need numbers, need data. And we'll use that from the stakeholders, from the experts, from the literature to supply the data, which is mainly related to the probability of the things happening based on the knowledge available. And we use this simulation, the computer model, and you will build the design scenarios, different scenarios for the strategy decisions, and you can test that and build and simulate the situation and conduct and experiment different scenarios and the different things. And usually we do the like a web-based delivery tool, the dashboard, where you can see the results. We sometimes will be very, very unique and very, very interesting to show the outcomes, because using this simulation means that you see the future. If we did this for this number of years, this will be the outcome. If we did the other thing, the simulation, and there's some changes in factors, this will be the outcome. Because you almost build like a virtual reality of what you are trying to do. They are different model, different software to do the modeling. Powersim Studio have software to do it. Semantic System Dynamics, Bensim, Stochastic. If you search the internet, you can find many simulation softwares. Each one of them has pros and cons, and the familiarity with it is the most important thing. So in the simulation, the dynamic simulation give us this experiment before you implement. And it's open a window into the future, because you can see the results. You can see now if I did this intervention after 10 years, how are the outcomes? And based on that, you can adjust, so you can test different interventions, and then you select the best out of them. What people did in the dengue elimination. So also you can use it for the management of the performance, because in the performance management, you rely on the history, the past, what we know, and then you have the current performance, how people are doing now, and then you would like to look at the future. You have your goals, but usually you are uncertain about what to do and what will be working in the future. So the simulation will help you see the different performance in the future, not based on history only, but based on the current knowledge and based on your future interventions that you will be doing. Hope will not be like this, because this is what we are doing now. We use our experience to think about our future. And like this guy, he said, oh, a minute, yesterday you said X equals 2. And he would like to use that X equal 2 to solve the problem of today, where X equals 3, maybe X equals 10. And in the future, we don't know what X is. So in general, why summary of system thinking, why I think system thinking is important, because the aim at seeing how things are connected to each other within some notion of whole entity. You think about the whole, rather than using implicit models. System thinking methods use explicit models, identify the assumptions from the stakeholders, different people. And also it use data, it's not just assumptions. Can be repeated by others, because once you develop the model, people can think about it, can repeat that. And the most important thing is to contribute into understanding how things stand together as a whole. And that may be the most important thing in system thinking, dynamic modeling. Usually, the applications of dynamic simulation is used for training and education, especially, for example, in leadership. Here we use it in leadership development courses, because you will give the opportunity to the trainers, for example, to manage a company for 10, 15 years in a setting of 3 days, and they can learn from their mistakes, they can learn from their successes. And we have one of the simulation, which is it's a competitive environment for competing for. We create 4 or 5 teams competing in the same market, and they are the CEO and the team managing these companies, and they take decisions and they run these decisions for 1 year. They can see the outcomes, and then they can run it for another year. They can see the outcomes. So in a 3 days, they can see themselves managing this organization for 10 years. This is experiential learning, because the experience, taking the decision, seeing the consequences, and then adjusting their decisions. The second part can be used for strategic planning, because you can test the what theory, what if theory, what if happening, and then you can test that, and you can select then from that the strategies that work best for you. Also, it could be done. You can use it for just intervention planning, and because you can design different interventions and you experiment them, and then select the best one for you. Also, it could be used for performance management, because during the implementation, you have a plan. During the implementation, you can see the progress, and then you can adjust during the implementation. You can adjust your interventions or the actions based on the outcomes that you can see in the simulation. These are the main issues. For example, here's the plan for the effective interventions. Why? Because you have better understanding of the interdependencies of the system. Also, you will be forced to think about the constraints in the system, and also you will be forced to think about the resources, the strategic resources that you have, the drivers of these resources, and you will think about the performance measurement, but you need metrics to measure the outcomes. Also, you will have a better opportunity to interpreting the results and taking future coordinated action based on these results that you can see. In the last part, I will just share the titles of these papers that you can look at it by yourself. It is in this paper they use thinking, the system thinking and dynamic modeling. Model for collaboration, how the system dynamics help a community organize cost-effective care for chronic diseases. They use the system thinking and dynamic modeling to build a system in Washington State, in one of the counties there, for care of chronic diseases, used by different participants, bringing stakeholders together, and they build different models, and the community and the stakeholders, they bring the patient, they bring the insurance, they bring the healthcare workers, and together they build this model for care. And in the paper, you can see the models, you can see different components of it. I like this because the first one is chronic diseases. This one is communicable diseases. Evaluating epidemic interventions policies with system thinking, case study of dengue fever elimination. They build different, because for the elimination of dengue fever, there are different interventions. It's like a combination. It's like you need to select how much I will put in education, how much I will put in indoor spray, how much I will put in the outdoor spray, how much I will put in mobilizing this. So they put a combination of these different interventions and they simulate that. And based on these simulations, they select the best combination of different strategies and then implementing that. And with cost effectiveness models and everything. So this is this variables is very interesting. You look at it, 1999. Just recently, this paper has been published about system dynamics modeling for public health, the background and opportunities in the American Journal of Public Health in 2006, and also explore different ways where you can use system thinking. From practical point of view, the community health advisor.org is dynamic. It's used, actually it's not 100% dynamic, but they have mini simulations to talk about different risk factors and the savings of life, savings of resources if the county or the state implement these interventions. You have different policies, different policies related to tobacco, physical activity, and nutrition. And this is online, and you can go in and play around, and you can see the results in the 5 years, 10 years, or whatever. And the information feeded in the system is US only, but the background document can explain more about how they build the dynamic modeling, the mini simulations. I think Hatim, this is all about what we have. I hope that it just opened the door for thinking and sharing ideas. Yeah. Mike is yours.
Yeah, شكرا جزيلا. Thank you so much, Dr. Abdelrahim. This is very interesting, and definitely it opens the door for thinking and also for further knowledge. And I'm sure the audience has a lot of questions as a curiosity to know this. But let me first of all أتقدم بخالص الشكر والتقدير لكم دكتور عبد الرحيم، أيضا الأستاذة تبريكة شكرا جزيلا، تبريكا لإدارة النقاش من البداية وأيضا للحضور. ولعله الآن يعني خطر في بالي سؤال يمكن بنسأل فيه يوميا: متى يعود العالم لطبيعته after COVID-19? And this is actually a question definitely need system thinking answer, because we know COVID-19 is a complex problem with different dimension: social, economic, political, and even sometimes spiritual. So you mentioned a very interesting approach for system thinking, or use for system thinking is a use for prediction of outcome in the future. So is there any attempt to use the system thinking and system dynamic simulation to answer the question when the life come to normal with this COVID-19 and different virus, and every day we heard about screen? شكرا دكتور عبد الرحيم مجددا.
Yeah, there's very interestingly the Association for System Thinking Association. They have a health interest group, and they have initiative now they are working on the using the system thinking and modeling. They have two challenges now. Actually, the one challenge started in 2019, which is how we can use system thinking dynamic modeling to address the cancer issue. And they are working on that. The other one is this COVID-19, and they have a special group working on it. There's still nothing coming out, but they are working on that issue.
شكرا. ايضا اي سؤال يا شباب؟ any question؟ احنا نرحب بكل القامات المعانا، مشكورين. any question سواء كان عن طريق الشات او even يعني دايركت، feel free.
You have can see in the screen Dr. Bani. I would like to say Assalamu alaikum, and I'm very happy to have you here.
دكتور باني، والله نسمع صوتك سعادة الدكتور، شرفتنا كثير يعني. if possible دكتور. كل الناس يا دكتور عبد الرحيم يعني بيشكروا فيك، وديفينيتلي التوبيك يعني جديد. انا لما كنت بصراحه برسل الانفيتيشن ناس بيدخلوا علي بالخاص يقول لي قاصد شنو؟ بقول لهم القاصد ده بعدين تعال احضر المحاضره. بس يعني ما شاء الله عليك انت فتحت افاق في السيستم ثينكينج، وانا يعني حاسي حتى في الحياه العمليه يعني الشخص دائما بيقول لك ما تغرق لنا في شبر مويه. You have to think in يعني system way of thinking. So definitely very useful. Any question يا شباب؟ هل في أي حاجة يعني need to be clarified؟ الموضوع very interesting. Dr. Abdelrahim, we would like from you to share the presentation as well as the يعني papers لو أمكن.
Okay, I will share it with you إن شاء الله.
ونذكر إنه برضو المحاضرة مسجلة إن شاء الله بعد أفتكر مسجلة من طرفك دكتور عبد الرحيم، صح؟
مسجلة هي، أيوة شغالة.
خلاص إن شاء الله برضو we will have copy of that بعد البرزنتيشن.
Okay.
أي سؤال يا شباب؟ اي سؤال؟ اي اقتراحات؟ نحن بنقترح دكتور عبد الرحيم لو امكن، نحن we know you are so busy، انت يعني في وقتك وكذا، لكن we will look forward to have يعني التريننج اللي اتكلمت عنه. is it possible يكون virtual تريننج زي ما نقول بعيشك الجو بتاع الليدر والسيميوليشن وكده في ال3 يوم؟ is it possible يكون virtual؟
والله يا اخي ما اعتقد انه في جروب وير، في شغل بتاع جروب وير كتير.
نعم.
ما يعني الان معظم الشغل شغالينه فيس تو فيس.
نعم.
لانه في شغل مجموعات كبير جدا وبيحتاج لدايفرسيتي في التيمز.
نعم.
لكن نولج شيرنج في اي وقت في اي حاجه ممكن يكون مثلا في سبيشال سيشن عن الارك تايبس، سيستم ثينكينج،
اوكي.
بتقرب الفكره.
اوكي. 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 مشكور، ما بتقصر. Any question يا شباب؟ Any comment? Any suggestion before we conclude? طيب قبل ما نديك كلمة أخيرة دكتور عبد الرحيم، برضو دعني I would like to appreciate the effort of Mr. Maher Al-Mahdi. He is the Dean of the Virtual CIC Academy، ونحن يعني ممتنين له بالراجل سواء كان في ديزاين للإعلانات أو الزوم. Thank you so much Mr. Maher. And also would like to remind this session is 12th session of the Sudanese CBHQ, CIC, CBBS, risk management, BMB, and يعني quality group. وهدف هذا الجروب زي ما تكلمت معك دكتور عبد الرحيم انه to increase الكاباسيتي خاصه لزملائنا في السودان في الاريا بتاعت البروفيشنال ديفلوبمنت، في الديفرنت سيرتيفيكيشن. ونحن عارفين التشالنج اللي ممكن تواجه الناس في الديفرنت سيرتيفيكيشن، وانا افتكر المحاضره دي غطت تقريبا كل اللي درس بي ام بي او امتحان بي ام بي بيلقى موجود السيستم ثينكينج موجود، يعني بطريقه قد تكون ريليتد للبروجكت مانجمنت. الكواليتي اوف كورس موجود، في الانفكشن كنترول برضه موجود، وفي كل الشهادات الاحترافيه. فشكرا لك مجددا. المايك لديك دكتور عبد الرحيم في تيك هوم مسج والكونكلوجن.
طيب اولا شكرا جزيلا لحاتم وللزملاء في المجموعه، وشكرا جزيلا للحضور لمشاركتهم. the only thing is that التيك هوم مسج انه اي زول انترستد في كورسيرا عندها كورس جميل جدا بتاع سيستم ثينكينج بابليك هيلث من جون هوبكنز. الناس ممكن يشوفوه introductory course فيه الاشياء بتفصيل شويه. و just try to use these tools if you would like and build the capacity بتاعت الناس، لانه it's just a way of thinking. Once we get used to it, then it will come naturally في البروسيس بتاع التفكير بتاعنا.
ممتاز.
شكرا جزيلا.
شكرا جزيلا، ويعني تصبحوا على خير، وان شاء الله نلتقيكم الجمعه القادم او السبت في موضوع جديد. السلام عليكم ورحمه الله وبركاته. شكرا.